40s is the time when you are more concentrated on your career and family, leaving you with very little time to take care of yourself. But 40s is also the time when you do need to take care, because it is at that juncture of youth and old age where, if you are invested on your health and taking care of yourself, it would eventually make your later life healthier and more productive. Health screens or preventive health checkups have a very important role to play here, because they help in detecting diseases early, even before you have symptoms, making them easier to treat. So, what are the very simple tests that you can get yourself checked for at the age of 40? Number one is your blood pressure. We know that hypertension is a silent killer. It may typically not be producing many symptoms initial on, but results ultimately in stroke, heart diseases, and a general ill health. The very simple way to detect hypertension or high blood pressure early is to get yourself checked at least once a year for your blood pressure, and more frequently if you have a family history of hypertension or cardiac diseases. Second is diabetes. India, as we know, has the second highest population of diabetes in the world, with about 1 in 11 people being affected by the disease. According to the American Diabetic Association, it is very important for all persons after the age of 45 to get themselves checked for their blood glucose level once every 3 years. This includes a fasting blood glucose and glycosylated hemoglobin, that is HbA1c, to prevent complications of your brain, eyes, heart, nerves, blood vessels and kidney later on in life. Next comes cholesterol screening. Again, a very important test, but a very silent killer. As you age, your metabolism slows down. So the same food which you ate maybe at the age of 20 or 25 would actually add up and may not be suitable for you at the age of 40 and upwards. That's when getting yourself checked for your lipid profile becomes very, very important. It is suggested by the American Heart Association that you get yourself checked for cholesterol at least once in 5 years, and more frequently again if you are obese, overweight, have diabetes, or have a family history of cardiovascular diseases. Liver function tests, very important. Bilirubin, AST, ALT, ALP, and GGT all help us review your liver as well as the status of your biliary ducts, because liver is a very important organ, helping us with metabolism, the synthetic as well as excretory functions of the body. Kidney function tests consisting of urea, creatinine, uric acid, then the electrolytes like sodium, potassium chloride, also calcium and phosphorus. This helps us evaluate your kidney as well as urinary systems. This is particularly important for persons who already have diabetes or an elevated BP, that is hypertension, because diabetic nephropathy, if diagnosed early, can be treated and can be made reversible. Next, we come to heart health. We are talking so much about the importance of a healthy heart these days. So the basic tests that you can start off with are ECG, stress test. Then NT-proBNP, again a very important biomarker for risk assessment in patients of diabetes mellitus. HSCRP, again according to the American Heart Association, is an emerging non-lipid risk factor which helps evaluate your risk for a heart disease, particularly in patients who already have an intermediate risk factor for it. It is said that an ounce of prevention is worth a pound of cure, and rightfully so. So start early, get yourselves checked, and build up for a healthier and happier later life. If you do have any questions, kindly drop in the query in the comment box. Thank you.